Hello friends. So today I am going to discuss about a very common disorder to which we called as epilepsy or convulsions. There have been multiple number of patients from young adults, young to adults, children are especially affected with this kind of disorder. So what is epilepsy? So first of all, there have been it is diseases of brain, and the within the brain there have been brain cells which we called as neurons. There have been electrical activity that has been happening in the brain. The neurons, the work of neuron, the function of neuron is to transmit the information from one part of the body to another part. So during that activity, it produces electrical signaling. So if this electrical activity is sometimes due to any reasons it gets active more than its influence they may take place, so at that particular time the attack of convulsions comes to the patient. So at that particular time this internal behavior of the patient is gets disturbed, and due to that the convulsions has been started. So these are the common reason for the uh, uh, convulsions. So which are the causes of convulsions? So in India, if you basically think about the causes of convulsions, so infection of tuberculosis or cysticercosis is very common. So in the cysticercosis, there has been one parasite microorganism has been going due to unhygienic food into stomach, and later they invade into brain and they form the certain space occupied lesion in the brain which may causes the epileptic attack. Another common cause, especially in the young adults, it is stroke. Stroke is very important cause in the young adults that may lead to convulsion episodes. Then if the patient have certain accident and they have injury to brain, so this may be one of the major cause for the epilepsy. So there has been certain other causes also there. There has been many causes which are called as idiopathic, that medically the causes of this epilepsy is not yet known. So all these causes called idiopathic causes of epilepsy. So there is, in epilepsy, there have been certain phases of epilepsy. In certain patients, before an attack of epilepsy, this phase is called oral phase. So in that phase, many patients get hallucination of certain kind of smell. Many patients have certain hallucination of voices. In and the next actual start of convulsive state, that is tonic-clonic spasm. So where the sometimes whole body involved. If it is generalized seizure, the whole body gets involved. If electrical activity of certain areas in the brain it's invade, so it is called as focal area, we often call as, and sometimes on which part this corresponds to our body part, so it gets affected. Sometimes only hand gets trembling, gets started trembling. Sometimes it's get all these contractions all over the body, and certain epilepsy types in which there's been no complete this kind of activities, just patient is sits with no uh, conscious activity. So in that phase, generally it is called absence seizure. In that, just patient have certain movement of eyelashes, and the patient is totally blank for certain time, certain period of time, just for 10 seconds, 20 seconds. In certain cases, there has been called a postictal phase, in which the patient have involuntary urination, involuntary stool. So this is also happen with this kind of patient. So this is called postictal phase. So all these phases are there: oral phase, convulsive phase, and postictal phase are the three important phases of convulsions. So after that, uh, there has been some important thing that we should take consider for the epileptic patient. So first important that they should take proper sleep. So at least more than 8 hours, more than 7 hours at least. The patient of epilepsy that should not use mobile often frequently at night. They should not drive, or they should not do a work which will affect uh, epilepsy will affect, or it may causes dangers to them, so it should be avoided. The patient In epileptic patient, there have been certain factor which aggravates the epileptic condition. These are depression. Then OCD is one of the kind of disorder in which the patient have certain kind of a repeated behavior. So they should uh, calm down with all this activity. So in children's, we generally see those patients who have suffering from autism or ADHD, that is attention deficit hyperactive disorder. These are the patients who generally commonly affected with this kind of epilepsy. So my more important point is that in the particular treatment, those patients who has taking anti-epileptic medicines since very long time. So especially for the students, those are the patients who are attending their schools particularly, and they are on anti-epileptic medicines for long period of time. So these, by the side effect of this medicine, what happens, they their brains get slowed down. So at that particular period of time, they must be very active in the colleges, or they must be active in the schools, so that they could learn all these things. So at that particular period of time, you must take homeopathic medicines, because at that mm, period, you should be your brain should be active. It should not be a kind of heaviness in the body due to antiepileptic medicine. The patient may sometimes feel very drowsy. So all these things particularly gets covered with homeopathic medicines. Initially, we have to think about the tapering of allopathic medicines. After that, we started on homeopathic medicine. There been recovery is such a very nice with all this age factor. So you should start homeopathic medicines as early as possible to get uh, out from these hazardous disorders. So I hope this video is helpful for you. So thank you so much.